terms of the usefulness of the MDTs and how I see it in the future, I mean, the big issue that I see is people don't understand what's going on in the health system. And I've looked after people for 10 or 15 years who've had diabetes, and one day I'll ask them, well, tell me what you understand, what is diabetes? And they have no idea. And I mean, that was a terrible shock to me to realise that I thought I communicated what diabetes was, or whatever, heart failure or whatever, and clearly I hadn't. And that issue affects whether people use their medications and whether they make any changes in their lifestyle. And I do see that the care plan, people being able to see their care plan, be able to look at what we've talked about, I think that is a way of increasing health literacy, in a small way for each person that we come in contact with. The issue of communicating with secondary care has been vastly improved with the MDT process. But I do think that the way that the communication channels have improved through the MDT process, and is having an effect on us. I mean, we get so much feedback from secondary care that we can then help the patients with in terms of where their health is going. We have been able to look at advanced care plans in two patients' shared care plan, and it's just fantastic because it's probably taken 3 or 4 months to actually talk to the patients about it, and for them to write down something and then to get it put into the plan. But now we have these plans easily visible in the shared care platform, and I can go and change it, the patients can change it. So that's fantastic, because that's one of the other things that I've been really frustrated with, is the lack of advanced care planning that we do, and it's been quite difficult for us to manage that, and as well it's something that's poorly done across the sector. And I think if we have an easy tool like this to use, it's going to make it so much more acceptable and so much more used. We feel that we're doing the best we can when we talk to each other, and it has improved the communication with the secondary care teams enormously. I was at a meeting with Gloria, and we were talking about a couple of patients who we'd had difficulty getting their care plans visible for us, and we just managed to do that, and it was really, really fantastic to be able to see this plan that people had written, and it was easily accessible in the shared care. And now I can say to the patients, well, your plan is there, and whatever happens, it's there for everyone to see.
I definitely agree with you, Mark, that the whole idea of having different organisations, you've got hospice, you've got primary health and secondary care all coming together in terms of the ACP to make sure everyone's on the same wavelength, creates that fluidity in conversations for that time in a patient's life where the ACP has to come into effect.